Hello everyone and welcome to my YouTube channel Enlightening Medicos. So today we are going to discuss about NTEP or National Tuberculosis Elimination Program. NTEP, earlier known as RNTCP, Revised National Tuberculosis Control Program, is the public health initiative by the Government of India that has a mission to eliminate TB by 2025. The tagline of this program is TB Harega, Desh Jeetega. What are the targets of NTP? There are three targets of NTEP. Number one, elimination of TB by 2025. Number two, to reduce mortality of TB by 90%. And number three, to reduce incidence of TB by 90%. So, now we will discuss in detail about this program. National Strategic Plan for the Elimination of TB. This plan was launched in 2017 and the target is to eliminate tuberculosis by 2025. The vision is to have TB-free India with zero death, zero disease and zero poverty. What is the strategy? It's a simple strategy: detect, then treat, then prevent. So efforts are made to universalize the CB-NAT, which is the cartridge-based test to detect, which is a diagnostic test to detect the tuberculosis. And if there is anyone with history of cough more than 2 weeks, it will be called as presumptive TB case, and CB-NAT is done at the baseline. TrueNAT, developed by ICMR or Indian Council of Medical Research, is an Indian version of CB-NAT. This test gives results for rifampicin resistance within 1 hour. New drugs like bedaquiline and delaminate have been introduced and shorter and longer regimens are also available. JEET strategy is the joint effort for elimination of TB. The main reason for starting this is non-notification by private practitioners, and TB is not completely eliminated. So the strategy is to increase notification rates of TB by the private practitioners or PP, the Indian organizations, ministry, NGOs, non-governmental organizations and international organizations are working together to eliminate the tuberculosis. Case detection. How do we do case detection? First is active case detection, second is passive case detection. So in active case detection, house to house search for TB cases is done. ASHA workers are given rupees 500 for finding a presumptive case, and any member who voluntarily helps to find a presumptive case gets an incentive of rupees 500. Vulnerable groups are slum dwellers, prisoners, migrants, tribals, shelter homes, etc. Intensified case finding means provider-initiated screening of TB symptoms in the OPD. Patients presented to the health facilities with other comorbidities will be screened for the tuberculosis. So in this way, by active case detection, they can go from home to find the cases of TB and will get rupees 500 incentive. Now what is community-based screening? In this, the ASHA worker fills a community-based assessment checklist known as CBAC form, asking the risk factors for diabetes along with TB. She gets rupees 10 for per form filled. What is the positive case detection? Passive surveillance from the hospital reports. Then what is presumptive TB case? Any person with cough more than 2 weeks duration or more. Negative test means repeat testing till 2 months and confirm HIV status by 2 years. Any individual having fever or night sweats or appreciable weight loss of more than 2 weeks. These are the symptoms which are presented. So that is for a negative test. What is MDR-TB? MDR-TB means multi-drug resistance TB. And what is XDR-TB? It is extensive drug resistant TB. Now we will discuss about suspected or confirmed extrapulmonary TB, having cough of any duration, HIV positive patients having coughs of any duration. There are three categories of TB patients. Category 1, newly and previously treated TB patients. Category 4 multi-drug resistant MDR-TB. Category 5 extensive drug resistant XDR-TB. What are the incentives under TB? So there is Nikshay Poshan Yojana, in which the nutritional incentives of rupees 500 per month are given to all the notified TB cases or patients. There is an Aadhaar link transfer, including patients notified by private practitioners also, and the incentives for tribal patients is rupees 750 because they are difficult to find. So these are various incentives. Then incentives to treatment supporters, the DOTS provider who ensures treatment completion of new and previously treated case, rupees 1000 is given, and for drug resistant TB case, rupees 5000 is given. DOTS is directly observed treatment short course for tuberculosis. What are the incentives for private practitioners? So on notifying a case of TB, rupees 500. On notifying treatment completion, again rupees 500. Then total incentive for the complete case is 500 plus 500, that is rupees 1000. So we will notify the case and they will also treat the patient. Can notify a TB case up to a duration of 30 days. And if he fails, then the private practitioner is punishable under IPC section 269 and IPC section 270. Now, what are the other technology-based initiatives other than CBNAT? So there is Nikshay, an online software for reporting and the compliance of treatment. There is DOTS 99, and there is MRM container box, which is a GPS-enabled box. It detects when the patient has taken the medicine and informs the Nikshay portal. So thank you so much. I hope you enjoyed this video, and please like, share and subscribe to my channel. May God bless you all. Have a nice day. And if you have any further doubts, please feel free to put it in the comments. I'll try to answer it as soon as possible. Thank you so much. And please let me know in the comments if you also want any other topic. Thank you.